research project that I directed in collaboration with John, who's here, as well as my colleague Megan Joy, Idil Attack from Ryerson University, and Graham Edson from X or Ryerson University. So the project focuses on understanding the impact and the experiences of immigrant serving agencies when it comes to municipal sanctuaries or access without fear policies in Canada. What are those policies, in case you don't know? So they target primarily immigrants without status or living with precarious status. It's cities. In Canada, so far, we have 7 sanctuary cities, Toronto, Vancouver, Montreal, Hamilton, Edmonton, London, and Ajax. And in a forthcoming paper, my colleague Megan Joy and I talk about how in Canada it would make more sense to talk about localist access policies as opposed to using the language of sanctuary cities, because ultimately what those policies do, with some notable exceptions, is mostly to provide access to services and provide information, but does not necessarily entail the provision of new forms of ID, though there are some experiences in Montreal, or fund services for non-status migrants. And they also, which is a core difference, have no impact on how police in cities actually interact with non-status migrants, as well as whether they collaborate with enforcement agencies. So this is our starting point, but the project was mainly focused on understanding how the agencies that serve immigrants understand the need of the populations that are targeted by these policies, whether they think that these policies actually have an impact for immigrants living without status, and what are the views, or what would be the preferences of these agencies for new or changing municipal policies. And this decision to focus on agencies is important for 2 reasons. First, because we consider them as proxies for these populations, non-status or precarious, or migrants with precarious status. It is much safer and easier to reach the organization, though it comes with bias, obviously, but we still decided it's better. But also because ultimately, and John has, I think, described it quite well in his work, because they are the street level bureaucrats of immigrant integration policies. And Annie just talked about it as well, right? So they are the one delivering the programs and interacting on a daily basis with immigrants through their integration process, but also when they have to negotiate status. So we decided to focus on them. Sorry. Okay, so what did we do? So we conducted a national survey of immigrant serving agencies or nonprofits. Is somebody sending me a message? No? Okay, sorry. And we did it between 2018 and 2020. It took longer to collect data than we expected. It also took longer for us to get to our sampling frame, and we can get to that in the Q&A. And so what we did is actually acquire a list of all the immigrant service agencies in the country from IRCCs, as well as from the Quebec Government of Canada. And it allowed us to actually have their email and be able to send them a list of questions to be filled regarding our research topic. Obviously, this is not a probability sample, and there are a lot of things we can do in terms of kind of doing regressions or extending the generalization of our result. But still, it's looking at how organizational research is done. This is a pretty good method. And we were able to get over 200 responses from multiple cities in every provinces and territory of Canada. And this brought us to about 48% response rate for agencies that receive either provincial funding or federal funding to provide services for immigrants. And so what did we do? We asked them questions about their experience in service non-status migrants, their experiences with the policies, and what they would like to see in the future. So the first, I think, result, what we show basically in the chapter and what we show in the study in general is that indeed, there is a need, and I think that if you've been working on with actors on the ground, you know this, but it's nice to have some kind of quantification of it. It is helpful. So 76% of the agencies that we have surveys have talked about receiving oh, they request so they receiving requests from immigrants without status to receive service. I'm sorry, there's a typo. And 76% of them also tell us that they when meeting immigrants, they ask them about their immigration status before providing them with services. So they cited two reasons to do that. The main reason was that they had to do it because of IRCC. And I mean, we have so many quotes in the survey. It's like, well, our funder demands to know whether the person is a PR, whether the person is a refugee or an asylum seeker. But a good number as well of respondents talked about the need to ask for status to plan better their interventions. So for a lot of them, the question wasn't about whether they were eligible for services, but it was more about to understand the kind of services they needed. Organization surveyed talked about receiving between 1 to 20 requests from immigrant living without status a month. I'm still doing some work trying to actually, make some kind of sense with the data to know how's the relation between organizational size. But the point is that these are seen as constant, not always super pressing, and it would vary from cities to city. The most requested services from these population are recommendation for legal advice, assistance with status, information about resources and referral, health services, and employment services. And we don't have a base to compare with the general population or the PR population, but we do know that recommendation for legal advice really came at the top of the list. And only 21% of the agencies that we have that has answered the survey talk about having access to some funding to serve these populations. So the reality is that none of the organizations we survey say they would not provide services to non-status migrants to the best of their capacities. But, and I have some quotes here. The first one really kind of like sums up what we found is that, this is volunteer work. We are not paid to do it, but we'll do it the best that we can. Another case that we saw was, and that's the second quote, is organizations that have a charitable status or that have access to other forms of funding that aren't either associated with the federal immigration programs or that are or that comes from private sources. They usually are able to fund services for these population much more easily. So the results here are pretty simple. So there is a constant demand for such service. Those services aren't funded. And the services mostly have to do the needs mostly have to do with all the services, but help with legal issues and status are really important. Now we move to the second part or the second question of this project, which is, does it make a difference, right? Like, what about like the organizations that live in municipal sanctuary or sanctuary cities or in cities that have access without fear policies? Does it actually make a difference in the lives of their clients? Here again, right, this is kind of two steps. So we can talk to people living in those cities, but we did find some interesting but not surprising results. So please excuse the worst slide ever. Okay, I just wanted to show quickly a little bit. So one of the things we did is that we asked providers about base we ask providers, based on your client's experience, how often do the following municipal services inquire about immigration service, about immigration status before providing services? And so we ask about tons of stuff that can be tons of municipal services. And I don't have here in the same slide the results in non-sanctuary cities, but I can just point to a couple of them, right? So for example, they say that bylaw officers in sanctuary cities still continue to ask almost always about immigration status. Um, and this is also the case for non-sanctuary cities, but the result is even higher, right? So there's a much higher rate of requesting immigration status. Another interesting finding is we asked about emergency services, so first responders, firefighters, ambulance, and all of that. So you can see that in the sanctuary cities here, if you can see it, I should have a pointer, but I don't. The always is not as much as the rarely, though in non-sanctuary city, about 64% of the organization reported that first responders or emergency services asked about immigration status about 64% of the time. So it seems to be a decrease. In terms of police, you can see that the occasionally and always is pretty high, and it is lower than in non-sanctuary cities, but remain probably none. Like the difference wouldn't be significant if we could actually test it for it. And in terms of the transit system, things, yeah, 2 minutes. Yeah, in terms of the transit systems, it doesn't seem to make much of a difference. So we still have to dig into those results to make them nicer. But what I can tell you is that the differences don't seem so big in most of the cases. We also asked them about the experience of their client in terms of feelings. And so two things here, we have a big battery of questions. I'm just going to talk about two things that are interesting. So we asked them about their feelings of the overall feelings of fear of their clients. And here you can see that for a lot of the respondents living in sanctuary cities, it seems like not a lot has changed, right? So the enactment of a sanctuary city policy doesn't seem to have decreased the feeling of fear over deportation or loss of status. But interestingly enough, it seems to have changed something about their feeling of safety in the city, right? And how like respondent might feel better living in the city, interacting with local services, though we still have to look a little more about those results. Are there some preferences? In light of those lukewarm results, what was really interesting when we asked more about the preferences to agencies, a lot of them were actually kind of, they were generally okay with it, right? So they were okay with continuing to have a formal policy. They were okay, and they actually wanted to have more policy work and more reflection when it comes to thinking about moving to new support for non-status population. And they also expressed a desire to see municipal government become more active in the provision of housing and access to health for these population. But then again, right, also recognizing a lot of these things aren't city jurisdiction. And I'm just going to end here with those quotes from the survey. So, the first quote is something that we found really often coming in comments, which was like, you know what, like, let's just not get the city involved. It's just none of their business. So keep the municipality out of things. A second respondent saying, healthcare and motor vehicle licensing would be number one, and that is provincial jurisdiction. So there seems also to be a clear kind of like, consciousness rising or pre-existing consciousness about who is responsible for what. And one of my favorite quotes in the survey, which is like, the moral of this experience is that only agencies can be the best to to protect or carry or to support non-status populations. Agency need the funding, and agency will be the best actor to bring services directly to non-status populations. So, the situation is complicated. We know it was, but agency